Hi, my name is Darren Kadis. I'm a neuroscientist here at the Hospital for Sick Children. I study the human brain, specifically children's brains. The brain is an extremely complex organ, and it's responsible for everything that we do, including how we move and how we think. In my research, we study how the brain supports language in childhood. Ever wonder how you learn to talk or understand speech? That's all here. The brain is amazing, especially in childhood. One cool thing about children's brains is that for some functions, like language, the brain can change or adapt when it gets hurt. When an adult's brain gets injured, it can't always recover, but a child's brain has the ability to adapt, and we call that plasticity. Think of it like clay. When clay is new and soft, you can create different shapes or sculptures. The clay is easy to mold into new shapes, but as the clay gets older, it gets stiffer, and it's harder to make it into something else. Okay, let's use our brains and think about a complex process like having a conversation. When someone speaks, the first thing that happens is you hear it. After hearing it, your brain interprets what you heard.
Oh!
And then your brain thinks of an appropriate response. Finally, you respond by speaking. Seems simple, but a typical conversation between two people is a very complex process that happens seamlessly in most cases, thanks to how quickly your brain processes information. In young children, language is represented bilaterally. Bi meaning two, laterally, sides. So that's a big word meaning language in young children involves both sides or hemispheres of the brain. But in most adults, the major language functions are supported by just the left hemisphere. When an adult suffers a left hemisphere injury, they may lose the ability to speak or to understand the speech of others, a condition called aphasia. However, if a young child suffers a left hemisphere injury, the healthy right side of the brain might be able to continue to support them and their language needs. I study the factors that predict whether this can happen. In my lab, we work mostly with children with epilepsy. Epilepsies are seizure disorders caused by abnormal electrical activity in the brain. Seizures can result in changes in behavior, movement, or changes in awareness. Generally, epilepsy can be treated with medication, but in some instances, medicine is not enough. Some of these patients may benefit from surgery to treat their seizures. The purpose of epilepsy surgery is to remove the unhealthy tissue that causes the seizures while preserving the healthy tissue and protecting language and other eloquent functions. To do this, the child undergoes a process called brain mapping. We use different neuroimaging technologies to study the child's brain structure and its function. One of the technologies that we use is called magnetic resonance imaging, or MRI. An MRI allows us to take pictures of the brain in a non-invasive way. So this is one of our study participants' brains. We're coming at it from the bottom. So up here you can see their nose and their ears. You're going to come up and you're going to start to see the eyes. And of course, here's the brain that we're interested in. So we're going to go. Another technology we use is called magnetoencephalography, which is a huge word, so we call it MEG. MEG allows us to measure the magnetic fields produced by electrical activity in the brain. Neurons firing within the brain create tiny changes in the magnetic fields that surround the head, and MEG can pick up on those. Each of these squiggly lines is data coming in from a single MEG sensor. The ones here in blue are the left side of this brain, and the ones in red are on the right. So these are recording the amount of magnetic flux that's occurring just outside of the skull. By doing this, MEG can help us create a map of the brain. With these measurements, we can see how neurons change when a child is speaking or listening. These technologies help us guide surgery and allow us to study language and development. My hope for the future is that we're able to continue to develop non-invasive neuroimaging techniques that make surgeries more accurate and improve overall patient care. Like clay. That's a terrible catch.